Hey guys, Dr. Childs here. Today we're going to be talking about 5 reasons to go gluten-free if you have thyroid disease of any type. Okay, so if you have low thyroid function, hypothyroidism, hyperthyroidism, if you have even a thyroidectomy or RAI, so radioactive iodine ablation, I still think many of these reasons will be relevant to you, perhaps less so if you've had your thyroid removed or ablated, just in full disclosure. However, going gluten-free provides several benefits to people who have thyroid disease, and I want to talk about those in just a second. First, I want to talk about going gluten-free in general. Going gluten-free used to be kind of the fad, right? It used to be really popular if we go back in time, I don't know, 5-7 years ago, kind of before the time that keto came around. So before keto came around, it was gluten-free kind of had its time in the limelight. A lot of people were going gluten-free. People who didn't even have thyroid conditions, people who had all sorts of diseases were going gluten-free and seeing a lot of improvement. And a lot of the impetus or the desire to go gluten-free has kind of faded out recently, but I want to talk about why I still think going gluten-free is especially important if you have a thyroid disease. If you have Hashimoto's thyroiditis, no question that going gluten-free is going to be beneficial for most people. However, the question is, what happens if you don't have Hashimoto's thyroiditis? What happens if you don't have Graves' disease or another autoimmune disease of your thyroid gland? Is it still beneficial, let's say, if you just have low thyroid function, but it's not autoimmune related? And I think the answer is probably yes. And so here are 5 reasons why that is the case. I'll be making sort of a case as to why I think pretty much every patient who has thyroid disease should go gluten-free. So number 1, the majority of cases of hypothyroidism are caused by Hashimoto's thyroiditis. So when you look at the statistics, it's something like 70 to 90% of patients who have low thyroid function of any type. The reason for that low thyroid function is Hashimoto's thyroiditis, which is the autoimmune disease. And remember, in the very beginning, I just said that there's no question going gluten-free is helpful for those people who have Hashimoto's. At least the majority of people. Not everyone, but the majority of people who have Hashimoto's do see an improvement in going gluten-free. So if we just take a look at the numbers and we ask ourselves, what's the statistics that I have low thyroid function, or that my low thyroid function is caused by Hashimoto's, whether or not I know whatever my autoimmune status is, that number is very, very, very high. Why is this important? Well, you may think to yourself, well, I was never diagnosed with Hashimoto's, so it's probably the case that I don't have it. That is actually incorrect thinking, and here's why. Most people, most doctors, they're not concerned whether or not you have Hashimoto's. They're not concerned they're not concerned about your antibody levels. They're really concerned about your TSH. So you go to your doctor will order a TSH. They may or may not check your antibodies. Usually they do not. And then if your TSH is, let's say, 6 or 7, they'll say, oh, guess what? You have hypothyroidism, so take this thyroid medication forever. Now, had they looked at the right test, they would have discovered that most people, something like 90% of people, have Hashimoto's thyroiditis and their antibodies are elevated. But because they're never checking, so many people are out there with low thyroid function, they don't even know what caused it. And their doctor, they're going to their doctor, they're trusting their doctor, and their doctor doesn't have any concern about it, so they'll just never know. So a lot of people listening to this, including potentially you may have Hashimoto's thyroiditis, whether you realize it or not. Okay, now, in addition to that, there's one other reason. There is a condition called seronegative Hashimoto's, and these are people who have Hashimoto's thyroiditis when you biopsy their thyroid gland, but they do not have positive antibodies floating around in their blood. So there's probably, and this can occur, by the way, in about 10% or so, 15% of patients who have Hashimoto's thyroiditis. So when you put these numbers together, there's probably a good chance that 95% of people who have low thyroid function in the United States have autoimmune disease of some type, whether or not their antibodies are elevated. So when you put all this stuff together, it just makes sense that most people, because they probably have an autoimmune component to their thyroid condition, that going gluten-free would be beneficial. Number 2, going gluten-free limits your diet and may help you keep your dietary goals. Okay, so what do I mean by this? Basically what I'm saying is this. When it comes to improving your diet, there's no question that making changes to your diet impacts positively your thyroid health. Now, most people know this, right? If you're listening to this, you know it. I have lots of videos on talking about the connection between eating healthy foods, whole foods, and thyroid health. Now, even though they know it, a lot of people are not practicing it, right? Now, there's a lot of reasons for that. I don't think it's as simple as saying they just don't have the willpower or the desire. I think that's completely false. I think a lot of people have the willpower and the desire to do it. Maybe they don't know how. Maybe I don't know. There's lots of reasons why they're not doing it. But here's what I do know. Going gluten-free, because it imposes a certain set of restrictions on what you can and cannot eat, and because there's so much information teaching you how to do it, it's one of the easier diets to follow. If I came out and said to you, I want you to go paleo, well, there's a lot of different types of paleo. Or let's use keto as an example. Let's say I told you to go keto. Well, you could have unhealthy keto, you could have healthy keto, you could have keto that's predominantly high in fat, and some of them are higher in protein. There's lots of different ways to do the keto diet, but not every single way is equally as healthy as the other. The same thing is kind of true with going gluten-free. So by going gluten-free, by following a strict regimen, which necessarily removes certain foods, you're sort of forcing yourself to eat a healthier lifestyle and to keep those dietary goals that you're setting out for yourself to improve thyroid function. So even if it isn't the going of the gluten-free, which is beneficial to your body, it could just be that following the dietary pattern that you remove certain foods and keeping to it, sticking to your goals, your dietary goals, will help you feel better and help you improve in thyroid, help your thyroid improve, and you'll produce more thyroid hormone and feel better. So that's another reason why I think going gluten-free is particularly beneficial. Number 3, there's really nothing to lose by going gluten-free for 90 days. So in the very beginning, I don't think I mentioned this, but let me mention it now. When I'm talking about going gluten-free, I'm talking about giving it an honest 90-day trial. You don't have to go gluten-free necessarily forever, but I do think that there's a good case to be made for pretty much everyone who has a thyroid problem to at least give it a shot, go 100% gluten-free for 90 days. And part of the reason is the reasons I mentioned previously and the ones I'll mention in a minute, but the other one is there's really nothing to lose. So what do you have to lose by doing something? Whenever I'm looking at a therapy that I'm recommending to a thyroid patient, you always have to look at the risk versus the rewards. How much does it cost? Are there any potential negative side effects associated with it? And you can apply that framework to going gluten-free. So what is the cost of going gluten-free? It may be slightly more expensive, but in terms of the cons, there are virtually none. Going gluten-free for 90 days is not going to hurt your body in any way. So even though it may cost a little more expense, it may cost more time and energy and looking up gluten-free diets and going, figuring out what you need to eat and what you need to throw away in your pantry and so on, might be slightly more in terms of money, but you'd probably be surprised that eating gluten-free nowadays is not as expensive as it once was, even 10 years ago. So again, you've got nothing to lose, so it's a good thing to try and potentially a lot to gain. Number 4, many thyroid patients report feeling better on a gluten-free diet. So I'm going to talk a little bit about other patients now for a second. So when we look at other patients, when we pull them and we say, hey, thyroid patients, you with Hashimoto's, you with hypothyroidism, whatever it is, let's ask you some questions about what type of things you have done and what types of things have helped you feel better. When we talk about diets, when you pull these patients and you ask them, hey, did going gluten-free help you? Let's look at 1,000 thyroid patients and ask them these questions and see what happens. It turns out a huge portion of them, anywhere from 50 to 70%, depending on which population you look at. Obviously, it's going to be more skewed, highly favorable if you have Hashimoto's versus if you have other types of thyroid disease. But a huge portion of those people do feel better. So you don't need to do this. You don't need to go gluten-free as if it's testing for yourself, as if you're the only person doing it. You have the data behind hundreds, thousands of thyroid patients who have done this before you, who have done it and seen improvement. So that should give you a little bit of, or it should take away a little bit of pause that you might have in thinking that this won't work for you, because it has worked for other people. Now, it doesn't mean that just because it worked for other people that it's guaranteed to work for you. But if there's no risk and all of a sudden you know that there's a lot of other people who have done it, who have felt better, it makes it a little bit easier to make that decision. Okay, number 5, going gluten-free usually helps reduce carb intake, which may help with weight loss and insulin resistance. So normally, it's really easy to eat a lot of gluten-containing foods because they're cheap and they're highly processed and they're highly inflammatory in the standard American diet. I think most people know that: breads, pastas, grains, so on. It's really easy to get gluten in those forms. When you go gluten-free, you're sort of automatically removing a huge portion of these unhealthy foods, which happen to be stimulatory to insulin resistance or to your insulin levels, which then causes insulin resistance and so on. And when you look at statistics, we know that many thyroid patients suffer from the inability to lose weight. A lot of them have gained weight. Now, yes, that's usually related to their thyroid, but in a lot of people, that weight gain is related to insulin resistance, and that's related to your diet. So there's a huge number of people that if they go gluten-free, if they take out those unhealthy foods, which are high in carbohydrates and very stimulating to insulin levels, you might actually see some improvement in your weight, not necessarily because of its impact on thyroid function, although that can occur as well, but because of its impact on insulin levels and insulin resistance. Now, again, this isn't a guaranteed thing because there are definitely ways that you can just substitute out bread. You can glutinous containing bread with gluten-free containing bread, right? You could do that, but in most cases, it's more expensive. It's more difficult to do. It takes a little bit of getting used to working with the gluten-free powders to make it yourself if you're going to do that. So this kind of assumes that you're going gluten-free and also adopting a healthier lifestyle along the way. But I have seen it in a lot of people where they do this. Instead of just getting the gluten-free versions of the unhealthy foods they were eating previously, they're actually changing their diet. That's driving them towards better, more healthier lifestyle changes, which has a positive impact on their overall health in addition to their thyroid. So let's just wrap this up and say, I don't think that everybody who has a thyroid problem has to be gluten-free. I think if we go back in time and we look at, like I said, 5-7 years ago when the gluten-free was kind of the fad diet, maybe it was a little longer than that, but you kind of get what I'm saying. I think more people were on the gluten-free diet than needed to be. However, I think nowadays it's the opposite. I think there's more people that should be going gluten-free who aren't gluten-free, and they're missing out on that benefit. So the pendulum kind of swung in the opposite way. And I just want to kind of reintroduce you to this thought of going gluten-free and the benefits that it can potentially provide, and give you 5 reasons why I think it's a good idea to try it. Now, if you do this, you don't have to do it forever. If you can go gluten-free, 100% gluten-free for 90 days, that's usually a good enough time frame to see if it's going to benefit you or not. And guess what? If you do that and you find that it helps you, great. Continue to live a gluten-free lifestyle. If you do it and you find that it doesn't help you, well then fine, no harm, no foul. You haven't done anything to harm your body in the process, so you can go back to whatever you were previously. Or maybe you've learned some new techniques along the way in terms of how to eat a healthier diet, and you'll have a net benefit at the end of this. So that's what I'd recommend that you do. If you have any questions about going gluten-free or the reasons that I mentioned here, please leave them in the comments below. If you haven't already, make sure that you download my free thyroid PDF resources. I have tons of information all designed to help thyroid patients like you feel better. So make sure that you check those out. You can download them in the link below. Otherwise, that's all I have for you guys today. So I will see you in the next one.